I think that there is a 10 to 20 percentage of syllabus is more in NEET-PG, but the way questions are being asked in FMGs even nowadays are almost same, I think. Hello, sir. My name is Dr. Joshi. I have done my MBBS from Penza State University, Russia, and then I passed the FMG exam in December 2019, and then I gave my first NEET-PG attempt this September NEET-PG, and I got the score of 665 marks.
Wow, 665 is an awesome score, Doc. That
Thank
was
you.
the first attempt. How does it feel?
So it's very good, sir. Extremely
Yes.
bad.
So how would you be comparing the FMG exam with the NEET-PG exam? Standard
Sir,
wise?
yes, sir. I think that there is a 10 to 20 percentage of syllabus is more in NEET-PG, but the way questions are being asked in FMGs even nowadays are almost same, I think.
True. So it's just that negative marking, I think, and slightly more difficult
Yes,
big
yeah,
topics
yeah.
are asked.
Yes, sir. Due to its competitive exam, so negative marking. Yeah.
So how would you overall rate this exam? I mean, was it easy, moderate, difficult? What would be your take? Tricky?
No, sir. It was not at all easy exam. I would say that it was a moderate exam with a very tricky choice of options. And even when you see the question, you think that it's a very tricky question. How can they ask this type of question? But when you look at the choice, the answer which you are looking for, it's not there.
It's not there. Yeah, yeah.
And then you have to apply the logic and rule out the option, and then you can come to the answer.
Good. So how many questions did you attempt?
So I attempt all the questions, all 200 questions.
Very good, very good. Luck favors the brave. So was it like in a series you could attend 200, or like did you mark some for review and then you marked them towards the
Yes,
end?
sir. Yes, sir. I had marked, I think, 32 to 38 questions marked for review.
Okay, and then all of them you attempted. Great, great, great. So, I mean, were you not afraid of negatives? I mean, what was your strategy to reduce the negatives?
Yes, sir. So I was prepared before starting the exam that as the question are very less, like only 200 questions, so there will be a lot of clustering of the rank and marks. So I anyway have to be aggressive, and in this exam there was very less topic. I mean, I don't think that there was only one question that I had never seen before.
Okay.
So almost all the questions were similar looking. Like I know something about this. So you can easily roll out one choice, and in the remaining three choices, you can just look at if there any contradict between the statement, and that how somehow you can choose.
So in nutshell, Mit, what you're saying is that it's exclusion capability that one has to develop over time, and that you applied and deployed very well, and you were able to come out with flying colors. So when did you actually start preparing for NEET-PG? Like you cleared your initial exam, then would have done your internship. So I mean, did you start preparing in your internship? I mean, I'm talking about serious. I mean, we all prepare. Obviously, doctors are preparing all the time. I mean, serious study. I'm talking about.
Yeah, actually, sir, it all began from the January 2019. My goal was my ultimate goal was to give the NEET-PG and get the seat in PG before even the passing the FMG. It was like byproduct of the preparation.
Okay.
So I started from 2019 because we had to give MCA screening test in December. So simultaneously I prepare for both. Okay.
So like let's say 6 months ago, right? From today, how many hours were you studying every day? Because you see at that time, initially the exam also got postponed. And I mean, there was a lot of speculation. I mean, if I rewind and go back to January, February, then it was like maybe the exam may be postponed, it may be conducted. Then it actually got postponed. So I mean, like how many hours per day were you crunching per day?
So I cannot say exactly, but average I can say that it was 7 to 6 hours.
Yes, that is
especially during yes, especially during the postponement time in April.
Okay.
So and there were many days I didn't study at all.
True, that happens with all of us. So is it like 6 to 7 hours total, or is it 6 to 7 hours after excluding, I mean, lapse of concentration? Because we can't study, I mean, constant with all the time. So like, is it effective time 6 to 7 hours, or is it like, I mean, total hours?
Sir, it's not exactly like it's very a lot, because there was a very the postmodern and all and COVID, and
Okay.
so it's just average, and yeah, it was effective time, I can say that.
Okay, so then a lot of students, they make this planning like for few hours they will do MCQ, some hours they will do theory. So did you follow any strategy like this, or was it like you were going with the flow that you read a topic, do MCQs, read a topic, do MCQs? So what was your strategy?
Yes, sir. So, sir, before my MCI screening test, my main focus was clearing the concepts. My major chunk of the time I gave to the videos to clearing the concept, and yeah, I was doing cubing also, but most of the question I did from the FMG solutions and PrepLadder cubing, especially those rapid revision part.
Yeah,
I
I
didn't.
saw
Yeah.
that FMG questions were repeated, some of the
Yes,
pharmacology
sir.
and others. Yeah.
Yes, sir. Yes, sir. And when I cleared the FMG exam, my main focus was QBank.
Okay.
Most of the time I did retrograde study. I first studied the QBank and found out that what was the weak areas, and then I read the notes. And while reading the notes, I already had seen videos during the FMG preparation. If I found that I was very weak in those area, I would watch the video of this topic and this subject again.
Okay, so like in PrepLadder, you have a separate section for FMG and you have a separate section for PGME. So which videos did you use for your FMG segment? I mean, for PGME, obviously you'll be using PGME. Were you using separate or were you using the same set?
Sir, mainly I watched the NEET-PG video, especially
Okay.
medicine, pharmacology, anatomy, and
Okay.
in small subjects, I just watched rapid revision video in my
Okay.
FMG exam.
Okay.
And
And now you went
yeah,
through the entire modules.
yes, sir, yes, sir. But mainly my main focus in the last 5-6 months was rapid revision only.
Okay. So any favorite feature of the app that you like? I mean, which you think that
Yes, sir.
gave you a edge?
It's a mock test, grand test of PrepLadder. It's like real exam, because
Okay.
the difficulty of exam, it's not that easy or not that difficult.
Okay.
So it gives a real picture where you stand or
Yeah.
how our
So
preparation is going.
yeah. So you do, I mean, when you give the exam, it's like either you don't. I mean, it neither gives you over elation and neither it causes
Exactly, sir.
feeling like you are ending up with a bloody nose. It's like,
Exactly,
okay,
sir.
I did something and some things went right, some went wrong. Actually, that's, I think if you simulate the real thing, then with practice, your scores will dramatically increase. Sure. So any tips for future aspirants, especially in your Penza State Medical University? What would be you be saying to the young boys and girls out there? A shout out for them. They would be
So,
they would be rather calling you or pestering you, Vaya,
yes, sir.
this advice, tips, everything. So what's the shout out for them?
So I would like to stress upon two things mainly. First is that whatever faculty or coaching app or even anything you
True.
follow, just trust it, because everyone is best. It's nothing like that. So everyone is good here. You have to
Yeah.
trust them. So the FOMO has to be removed before you start the preparation. And second, never ever change your source. Never,
Yeah.
because
I
in
mean,
this marketing
whatever you
era, that
study.
yeah,
Yeah.
every day something new comes, and it that we feel a
True.
FOMO that I'm missing out that. And
Absolutely.
and sir, in exam I have felt twice in FMG and PG that we always remember what we have written in the notes or has seen the video many times, not something that
Absolutely.
in yeah,
Some rare facts do not matter.
rare
It's the
sex.
standard information that matters. True
Exactly,
love.
exactly.
Absolutely. So let's talk about you, Mit, personally. I mean, what's your favorite food items, and like, how does Dr. Mit relax or unwind when he's just feeling as if your head will burst? Because that's the problem with all doctors. Now we study all our life, so you have days when you are like, I just can't study. So when you wake up, that, I mean, I wanna know your approach. I mean, when you wake up with that feeling that what the hell am I doing with my life, studying all the time? So at that time, how did you unwind, or I mean, what did you do? I mean, what was your approach?
Sir, there was anything specific. I would do just
Okay.
whatever I like to do. Then there was nothing specific. I would do this.
Okay. Any
I will not
movies?
trust movies. No, sir. I'm right now. I'm seeing a Netflix series. Recently,
Okay.
I watched.
Okay, so now you have subscribed to Netflix. Finally, said, "Oh God, relief!
Yes,
enough, enough, enough,
really,
enough."
yes, sir.
Absolutely, I could sense it in your voice that you wanted to say that I need freedom from the books. True. No,
Yes, sir.
it's great.
Yeah, especially sir for FMGs, because we study for MCI also, and
Yeah,
then this NEET-PG also since 2019 January. So
absolutely. It's been almost 2+ years, and
yes,
it's
sir.
always an Herculean task actually that you and
But
yourself.
sir, yeah, now it's all worth doing. It was all worth what
Absolutely.
the sacrifices and
Yes, yes, all the sacrifices. So, any dedications to anybody?
so definitely my parents
Yeah,
and
they've been a
all
pillar
the
of your support, definitely.
exile and sir, all the PrepLadder faculties. They were
Okay.
many times, sir. I message you personally, Govind sir, that something that was not good in my life and marks was not getting increased and postponement on all
True.
and then the reservation thing. So,
Absolutely.
but
No, no, all is well that ends well, and you put in so much of effort for last 2 years. You have been enduring everything and putting up all the efforts. So the smile of
yes,
yours says it all. It's a combination of both elation as well as relief. I really can't
exactly.
predict what is more, but I definitely can. I can sense that. And considering the fact that you have made it into the top, I mean, breaking into top 1,000 is itself a big deal, and your rank is
Yes,
much superior to that. So I mean, I think everybody who's in top 1,000, they're all on the same plane. It's just that on that
mm-hmm.
day some questions might go correct for one person and they might go wrong for another person, so it depends on whether your mind clicks or not on that day. But I think that top 1,000 or even a little more than that, I can say, I mean, everybody has studied the same, everybody has made
Yes,
same
sir.
amount of sacrifices. It's just that at that moment, whether it is clicking or not for a person, that will make the rank go up and down. So
Exactly,
it
sir.
really does not matter. I mean, you've done brilliantly well. My best wishes to you, my regards to your parents,
Thank you,
and
sir.
I'm very sure that you will do very well in your life.
Thank you very much, sir. Thank you.